Pneumonia, a lower respiratory tract infection which manifests itself as an infiltration of the lung parenchyma. There are generally two types of pneumonia, the first being community-acquired pneumonia and the second hospital-acquired pneumonia. Hospital-acquired pneumonia is considered in all patients who develop signs and symptoms of the same after 48 hours of admission, and of course assuming that they had no symptomology prior to admission. Endotracheal intubation may also predispose patients to hospital-acquired pneumonia, and once again that will be after 48 hours of the procedure. Pneumonia will more often than not demonstrate itself on a chest x-ray as a consolidation. There are criteria that we follow after the clinical manifestation and examination, and the most well known here in the UK and endorsed by NICE, the National Institute for Health and Clinical Excellence, is CURB65. Outside the hospital setting, the urea aspect of CURB65 is often omitted for obvious reasons. The CURB65, each of these score 1 point, so your CURB65. C is for confusion, urea if it's greater than 7 millimoles, R for respiratory rate, which is greater than or equal to 30, R and then B for blood pressure if the systolic is less than 90 or the diastolic is less than or equal to 60, and finally if the patient's age is 65 or more. Each of these scores 1 point, and if the patient scores more than 1 point, we will consider antibiotics or treatment. If the patient scores 2 or more, it's imperative that we consider patient as treatment as an inpatient and therefore hospital admission. And finally, if the patient scores 3 or more, we would consider admission with some level of higher dependency, i.e. a high dependency unit. How do we remember CURB65? There's a little aid, something that I came up with a number of years ago. The more than and more than equal to signs are the most important aspect here. Confusion is, as it is, urea greater than 7, more. So if I come and ask you for more, I'm asking you nice and relaxed, just the first time, can I please have some more? On the second account, because on the first you didn't hear me or ignored me or however, I will ask you a little more assertively, and I'll emphasize that. More please, and that's the next one in line, respiratory rate. It's greater than or equal to. So the first one is more than 7, this because I didn't hear more, I said more than, and that's emphasized, greater than or equal to 30, that's your respiratory rate. The next one, blood pressure. You have 2 components to this, less than, that's all, thank you very much, can I have less? And again, on this occasion, it's the first time I'm asking you for less, and so I ask without any emphasis. However, once again, you decide to ignore me, and so I have to emphasize it and say less, and that's less than or equal to 60. So the systolic less than, and the diastolic less than or equal to. And finally, the last one is your age, 65 years of age or more. And because when I asked you for more earlier, on the first account you ignored me, and so on this third occasion I'm going to ask, automatically I'm going to emphasize it because I know you're hard of hearing or otherwise ignoring me, and so I'll ask you on this occasion, emphasizing it. So in summary, it's more, less, more, and that's how you can remember your CURB65 and the signs with the associated criteria. Thank you for watching.